so wonderful for us to see this full house tonight and such wonderful energy in the room, everybody back after the summer, and good to see everyone, whether it's after the summer or just to be together, because we're really have not had all of these opportunities based on what's been going on the last few years. So we really appreciate and are enjoying everybody being here. It's my pleasure to welcome you all tonight. I am Susan Fox. I am currently the chair of the County Association and the president of White Plains Hospital. As I said, it's my pleasure to welcome you all to our annual Toasting to a Healthy Westchester dinner. It's wonderful to have so many colleagues from healthcare together in the same room this evening, many who call Westchester home. The WCA has a long history of bringing leaders together in pursuit of shared goals, which support economic growth for our region. This has been done through a focus on 5 key areas: real estate and housing, digital connectivity, sustainability, the talent pipeline, and of course, healthcare. Healthcare is an incredible engine in our region, representing billions of dollars in economic activity and tens of thousands of jobs. In this room, we all share in the challenge of our mission to provide access to quality healthcare. And it seems like this gets more challenging each year. The WCA has been a great partner in helping the healthcare industry to thrive in Westchester through its strong focus on advocacy. Michael Ramita and Amy Allen continue to champion the WCA's efforts on behalf of our sector, from working to increase the Medicaid reimbursement rates to shepherding the passage of several bills to strengthen the pipeline for talent in our area. This support is critical. I want to ask you to join me in thanking Michael, Amy, and the entire WCA staff for all of their work tonight and throughout the year. It is a lean but effective team, and we are very grateful for their efforts. So important is the membership's participation in the work, whether it's by attending conferences, networking events, these types of events, or participating or leading project and committees to drive success. I would like to take this opportunity to highlight and thank Derek Anderson, the Executive Director of Northern Westchester Hospital, and Bill Harrington, who I didn't see tonight, our former board chair of the WCA, for their work in co-chairing the Healthcare Consortium Strategic Work Group. Thank you, Derek and Bill. We are so pleased to be joined this evening by our friend, Amy Paulin. Amy has been a champion of healthcare issues and last year was appointed as the chair of the New York State Assembly Committee on Health. Thank you, Amy. We look forward to hearing from you in just a few minutes. Tonight, we will be honoring WCA Healthcare Champion Award winners Rita Mabley, President and CEO of United Hebrew, and Westchester Community Health Center, represented by their CEO, Judith Watson. I am proud and grateful to call these 2 women colleagues and friends, each a force in ensuring their communities get only the best care. Both Rita and the Westchester Community Health Center, under Judith's leadership, have an immeasurable impact on the health of Westchester residents. A well-deserved congratulations to you both. And lastly, we are fortunate to be joined by Michael Dowling, President and CEO of Northwell Health, as our keynote speaker. A little fun fact. I worked for Michael at Northwell when it was just North Shore LAJ. It was circa 1997 when I started working at LAJ, which was just about the same time as LAJ joined with North Shore. Michael and I spent some Saturdays with the 2 legacy board chairmen developing the mission for the new health system known today as Northwell. In my almost 14 years at the health system, I participated in and saw incredible change and growth under Michael's leadership. And in the 13 years I have been gone, well, let me just say, wow. The health system and Michael are everywhere. Did we just see Michael shaking hands with President Zelensky of the Ukraine? I have mentored many leaders over my career. One thing that I always tell them is to find your own leadership style, but always take the opportunity to learn from those that you admire and take the best from them. While I know Joe Simone will formally introduce Michael in a few minutes, I wanted to share my Michael Dowling takeaway. To be fearless. Michael has certainly demonstrated that there is nothing that will get in his way of providing quality health care. And I'd like to think I have practiced that in my own career. And it is perhaps a lesson for all of us here tonight. Michael, we look forward to hearing you in a few minutes. It is now my pleasure, actually, to introduce, little program change, she's over there, Andrea Stewart-Cousins, our Senate Majority Leader, who understandably can't stay the whole evening, but we're so pleased that she's here with us tonight, and she wanted to just welcome you herself. And then Amy's going to come up and welcome many others here tonight. Thank you.
Good afternoon. You all look great. And I think it's really wonderful to be together again. And certainly you in healthcare appreciate that more than most. So thank you for your leadership in what has been extraordinary times. And I certainly thank the County Association, Michael and Amy, for making sure that no matter what, we convene, we find time to exchange ideas, and we collaborate so that we can make sure that what people expect from a healthcare delivery system actually happens in our region. So again, it's just been incredible over the years to work with you, and certainly my friend Susan Fox, who is chairing the board, and everybody who spends the time to make sure that your legislators understand what the needs are in healthcare. I know you'll be hearing from Assemblywoman Paulin, who chairs the Health Committee for the Assembly and the Senate. It's Senator Gustavo Rivera. Most of you know that I have the honor of leading the Senate. But my leadership is only made workable because of the input of all of you. And one thing with the Westchester County Association is that there is never a session that a group from WCA doesn't come up and spend time talking with us in the legislatures on every single one of the 5 points that they focus on. But we know whatever those 5 points are, if you don't have your health, the other 4 really don't matter. So, cheers. Here's to good health. I really want to congratulate certainly Rita and my buddy Judith Watson for all that you do. And again, I think everyone who is engaged in trying to make sure that not only we meet the healthcare needs, but we exceed the expectations for the next generation and the next generation. And I would be remiss if I didn't shout out, I think I saw the Deputy County Executive, Ken Jenkins somewhere, KJ? There you go. Yes, so the other thing about how we do what we do, every level of government has to work with every constituency in order to get to where we want to go. And I'm sorry, Michael, I will not hear you, but Michael has a hotline to me, so I get to hear Michael whenever he needs to be heard. But again, thank you. Have a great night. Thank you so much for letting me say a few words.
Thank you, Senator. Good evening. I'm Amy Allen, Vice President at the Westchester County Association, and I have the pleasure of running our healthcare initiatives and work with many of you in this room. And it really is wonderful to be together for this Toasting to a Healthy Westchester dinner. It's actually my favorite WCA event, as it not only supports our healthcare advocacy and program initiatives, but we also get to celebrate the great work of all our amazing healthcare providers. And the food and wine aren't so bad either. We can't put on great events like this without the support of our generous sponsors. We are gratified to have so many great organizations support the work that we do to ensure a vibrant and secure healthcare sectors. And I know our sponsors are all listed in your programs, but please indulge me as I note them individually. Our connoisseur sponsors are M&T Bank, Montefiore and White Plains Hospital, Phelps and Northern Westchester Hospitals, which are part of Northwell Health, United Hebrew, WestMed, now Summit Health, and Lohud Gannett. Our aficionado sponsors, and we have lots, so hang in there, are Blade Urban Air Mobility, Bleakley Platt, Ferrari Associates North 80, and Westchester Community Health Center. And our enthusiast sponsors are Burke, C-Clean, Consigli Construction, ENT and Allergy Associates, EW Howe, Fordham University, Greater New York Hospital Association, Harrison Edwards PR, Healthy Connections, Open Door Family Medical Center, Unitex, and Westchester EOC. And one more special shout out to Three Badge Enology and Aries Wine, who have generously donated all of this delicious wine, which has been specially paired with tonight's menu, as you can see in your program. How about a nice round of applause for all of our great sponsors? And I also just want to echo my thanks to our government officials who are here with us this evening. We've heard from Leader Cousins. We'll hear from Assemblymember Paulin, Deputy County Executive. Ken Jenkins is here. Bridget Gibbons, who is the Director of Economic Development. Joan McDonald, who's the Director of Operations, are here with us, and we appreciate their partnership as well. And as you heard, we at the WCA are passionate about supporting our healthcare ecosystem, and we work tirelessly to ensure that our advocacy and initiatives will have an impact. Our priorities are developed through the work of our healthcare consortium, which Susan referenced, and we also work with our statewide and regional healthcare association partners, and I'm delighted that B. Grouse, president of Haney's, and Wendy Darwell, president and CEO of the Suburban Hospital Alliance, are here with us tonight. A major focus of our work is to help our area healthcare providers fill critical talent shortages. We are working collaboratively with leaders from healthcare and education to tackle this workforce challenge and build a sustainable regional talent pipeline. We're also filling talent needs through our WCA grant initiatives, such as the county-funded Healthcare Talent Pipeline Program and a similar program funded by New York State. To date, these programs have trained 180 potential healthcare workers, with another 50 in training this fall. And our area healthcare employers have already hired 90 highly qualified program graduates. And as of yesterday, we reached our initial goal for the county grant ahead of schedule. The combined salaries of those placed participants is nearly $3.2 million, or an ROI of 10 to 1. That's what I would call a good investment. So I want to acknowledge our Director of Workforce Development, Jason Chapin. Jason is here somewhere, say hello, who manages our grant programs and works tirelessly to fill your talent needs. And as Susan mentioned, on the advocacy front, we focus our legislative and regulatory priorities on securing funding for providers, passing workforce flexibility legislation, and addressing systemic market imbalances. And as you know, we are fortunate here in Westchester to have a terrific legislative partner with Assemblymember Amy Paulin. She has been serving her constituents since 2001 and is one of the state's most productive and successful lawmakers. And throughout her legislative career, and now in her new impactful role as Health Committee Chair in the Assembly, Assemblymember Paulin has been a staunch supporter for all of our healthcare institutions. She has graciously agreed to provide some remarks tonight, so I would like to welcome her to the podium. Assemblymember Amy Paulin.
Thank you, Amy, and to everyone here who has organized this dinner. And, you know, I remember sitting here last year and wondering, you know, whether I was going to be the health chair. There was some speculation that I might be, but in politics, you can't assume. But in January, I was appointed, and I'm very grateful. So, first, I want to give it's an honor, to share the podium this evening with Michael Dowling. His bio is so very impressive. It's almost a little intimidating sitting next to him. His devotion to helping everyone, including the working poor, especially the working poor, his fight against gun violence, a passion of mine, and recognizing that it's a public health issue, which not a lot of people do. Most of all, he's from Ireland, and next Wednesday, I'm going on my 4th trip to Ireland, and I only have, according to my DNA, 3% Irish, and I think it's a mistake. But it's a really fun country with warm and wonderful people, and even the food has gotten enormously better over those 4 trips. So that you don't have to hear from me again, I want to I want to please and I'm proud that and so happy that of the 2 honorees that you picked, Judith, who I've known for a very long time and has done an incredible job in her role. And also, of course, the Hebrew Home and, or United, sorry, Rita, who is the United Hebrew of New Rochelle. Hebrew Home is a different group. And Mazel Tov, Rita, on your award and your devotion, and we've certainly had so much interaction, and I've been very pleased to help your facility as well. So now I know that you're looking at me, what am I going to say about healthcare, and what do I even know after only a few months? So I clearly don't know as much as most of you in the room, but I can tell you about what I anticipate in some of the political arenas. So let me start with the budget. The state budget is the most important health document of the year. 2024 will be especially challenging. According to the Department of Budget, we're expecting to see a $9.1 billion deficit. Every governor, including Governor Hochul, has tremendous leverage in the budget process, and I would be surprised if she doesn't use it even more, especially this year. The budget process becomes a focal point of policy discussions. The budget allocates resources and sets tax rates, as well as becomes the way major policy gets enacted. For example, any change in the Medicaid program, which impacts everyone's health care, has fiscal implications and will be done in the budget. Last year, the final state budget included items such as registering nurse staffing companies to ultimately help bring down the cost of traveling nurses in our hospitals, changes to the number of managed long-term care plans that will serve persons in need of long-term care. In addition, the budget raised Medicaid rates for the first time in a long time for hospitals and nursing homes. It was a start. We know it's not enough, but this next year, it's doubtful if we'll get any more of that. This year, the migrant issue, which is enormously complicated and is having an impact on many parts of the social safety net services, is going to be the focal point, I think. Most uninsured patients showing up in the ERs around the state puts enormous pressure on the hospitals that is affecting the fiscal health of the system as well as the overall staffing challenges. And if we don't see that in Westchester, because we know how much it's dominating New York City, all you have to do is open the newspapers. You know that it's going to dominate New York State. New York City drives so much of what we do, and they're anticipated to lose even more money in their city budget, which is going to have an impact on state. While the solution is a federal one, we know that New York State will step up to some degree. And we already have many of my New York City colleagues calling for higher taxes, while the governor's calling for no tax increase. So the politics has already begun if you look for it. Overall, the health system in New York is still very challenging by workforce shortages at every level. And we must find even more creative ways to help. And I know this organization has been very much in the forefront of trying to support and encourage those changes, and we need to go further. Shifting gears for a minute, I want to mention some of my own my own pet initiatives, not exactly the right word, that I have carried through to this role. One is on maternal mortality, and just interested in maternal caregiving from the beginning. I shouldn't probably admit this, but I had home births, so I am a radical. So I bring that radical view to this role. This year I was able to secure $2.5 million devoted to addressing the high rate of C-sections and reducing maternal mortality. And I'm very proud that the Westchester Medical Center was a large recipient of those funds. Not all, but much of them. I'm also focused, although with the whole cannabis situation, I'm not sure how far I'll get, but I am super interested and I want to proceed with how do we make psychedelics, mushrooms, available for medical purposes. Its time has come. Science has shown that it helps reduce. It's appropriate for depression. I know for people who get cluster headaches and so forth, doctors are using these products and telling their patients to go find them. So we know it's being done undercover, and it's time that we make sure that our medical professionals don't get indicted because they're doing the right thing by our patients. So I am very interested in that. And finally, medical aid in dying, which is a bill I've carried since 2015. Its time has come. Since I've introduced it, there was only one state, Oregon, that had that ability when I started, and now 10 states plus DC allows people to die with dignity. We talk so much this year about Roe being overturned, and we're seeing how that plays out in our politics. But what is more fundamental than the autonomy over someone who is dying? That's all of us. So when we talk about the autonomy over our bodies, this is the issue, guys. This is the issue. So I don't know whether, again, I'm going to get it done this year. I can just tell you that I'm working on it. And I realize, not everyone might agree with the mushrooms, with the aid in dying, but I'm just letting you know who I am and what I'm doing. So chairing the Health Committee has been a dream for a long time. Throughout my time in Albany, I've always focused on mental and physical health, children's health, maternal mortality. This new platform as Health Committee Chair is a chance for me to zero in on my longstanding goals, whether you support them or not, because what we all know is that health is the basis for everything we do and can achieve. So I want to thank you for giving me these few minutes, and thank you for letting me be here.
Thank you, Assemblywoman. We certainly look forward to some of your pet initiatives, and we'll keep an eye on them. Now on to the celebratory part of the evening. I'm going to ask Michael Romita, our CEO, to join me as we present our WCA Healthcare Champion Awards for 2023. And the first award goes to Rita Mobley, CEO of United Hebrew. For over 40 years, Rita has spearheaded the growth and transformation of United Hebrew of New Rochelle into one of the region's largest multi-service campuses of comprehensive senior care. Rita is a champion and staunch advocate for her industry, which cares for the region's most vulnerable residents, our elderly. Rita serves on the WCA board and our healthcare consortium and always provides valuable insights. Please join me in congratulating one of tonight's Healthcare Champion Award recipients, Rita Mobley. Thank you. Bottle up.
Okay, thank
I'll
you.
hold this for you.
Okay.
Thank you very much, and thanks to you both and to your entire team for your leadership in Westchester and advancing ideas and solutions for all businesses in Westchester. We really appreciate everything that you do. And my congratulations to Judith Watson and the Westchester Community Health Center. You know, their mission to improve the lives of community members by providing high-quality primary care is something every one of us must champion, every one of us. So thank you, Judith, and your team for taking the lead on this important issue. Thank you for this award. My speech is extremely short, which you all should be very happy about. It's rewarding to be in the company of so many of you and such dynamic, powerful, diverse, and inspiring people who share similar goals to improve the quality of life for others. But no success happens because of any one person. I love what I do, and I do what I love, and there's no place I'd rather be. But I am here as a direct result of the support of our incredibly hardworking and compassionate team, a visionary board of directors, and people who are sitting with me tonight and who I see here tonight, who I consider friends, not only personally, but of our organization. Indulge me as I share this award with them and ask them to stand and be acknowledged. Thank you again, and have a wonderful evening.
Thank you, Rita. Our second award goes to the Westchester Community Health Center. The Westchester Community Health Center began its work as the Mount Vernon Neighborhood Health Center in 1973. Their ongoing mission has been to address the urgent need for preventative and affordable health care services among the area's underserved individuals and families. They are celebrating their 50th anniversary with a rebranding campaign, along with a $12 million investment to renovate and upgrade their Mount Vernon location. Accepting the award on behalf of the Westchester Community Health Center, please welcome their CEO, Judith Watson.
Very good. Thank you. Hi, everyone. Good evening. This should be higher, yes? This is my life. All right. Welcome to my world. So good evening, everyone. Susan, Michael, Amy, WCA family, thank you, thank you, thank you. We are humbled and appreciative for this award. And this really should be higher. Okay. Rita, I'd like to thank you for all of the amazing work that you and your team are doing. We oftentimes forget about the seniors, right? We're all going to be seniors someday. These are the folks who are taking care of the seniors, so please help me give them another round of applause. And I promise I won't go over 3 minutes. My staff, they're timing me. All right. So, joining me this evening to represent our over 300 employees are 10 employees from the Westchester Community Health Center, okay? And I'm going to quickly name them, and then I'll ask them to stand, and I'll ask you to help me to recognize them. So we have Cheryl, who oversees all things EHR. We have Maxine Lewis, who handles all of the money in the organization. We have Simone Walker, who is our 340B coordinator and also heads up our food bank, which in partnership with Feeding Westchester, last month alone, we fed over 5,000 individuals. 1 month, 5,000 individuals. And we do that every month. Klesi is our Director of Patient Advocacy. Dr. Akbas, one of our OBGYN physicians, after working really hard today, seeing lots of patients, she's here, Dr. Akbas. Zia Maracastro, number 2 and business office supervisor at our Yonkers Health Center. Dr. Joshua, our site administrator at our Yonkers site, Vicki Simmons, HR director and site director at the Greenberg Health Center, Estefania Mayas, our patient advocate at our Greenberg Health Center site, and last but not least, Leticia Soto, our personnel assistant at our Greenberg Health Center site. So please stand, and folks, help me acknowledge them. Thank you. To Rita's point, these are the folks that are on the ground taking care of all of the work at the health center every day. I am the face of the health center. These are the folks who are on the ground doing all of the work along with their 300 colleagues. They got us through COVID. They saved this county. They saved this county with vaccinations, and they're saving this county with food and whatever else Westchester's most vulnerable need. Okay, I'm almost done. Now, the Westchester Community Health Center ecosystem is comprised of primary care, primary and preventative, medical, dental, and specialty services. So that's what we do, okay? But in addition to that, and you are all healthcare folks, you know about the social determinants of health. We address those. And last month alone, 20,000 social determinants of health related visits at Westchester Community Health Center. And so again, this is what we do here, caring for Westchester's most vulnerable. Our North Star is what the great Mahatma Gandhi said. The true measure of a society is how we care for our most vulnerable. I can tell you this. At Westchester Community Health Center for the past 50 years and for years to come, that is what we do all day, every day. Thank you, Westchester Community Association, for this award.
Again, congratulations to Judith and Rita and their organizations. Okay, now you don't have to hear from me anymore. We're going to take a very quick break while dinner gets served, and then we will hear from our much anticipated keynote speakers. So a couple minutes and we'll be back to you.
To introduce Michael Dowling, I'd like to invite Joe Simone to the podium. Joe is the president of Simone Development Companies, one of the biggest names in the regional real estate market. Together with his daughters Patricia and Joanna and other members of his family, Joe has grown his company portfolio to over 100 properties and greater than 7 million square feet of space. Simone Development has been at the vanguard of healthcare-focused real estate for over a quarter century and spotted this metatrend here in Westchester before the rest of the market. On a personal note, our families have known each other through business for generations, and I'm happy that our professional relationship has evolved into a friendship.
Thank you, Michael. Wow, this is low. Good evening, everybody. You know, I learned something here tonight, thanks to Amy. All this time, and you mentioned that Michael is from Ireland, and all this time I heard that accent, and I thought it was Brooklyn all this time. So, I am truly honored tonight to introduce tonight's keynote speaker. A true rock star in healthcare, and is one of the most influential voices in the world of healthcare today. As president and CEO of Northwell Health, Michael Dowling leads a clinical, academic, and research enterprise with a workforce of more than 85,000 and annual revenue approaching $19 billion. Through his leadership, he has helped Northwell become the largest healthcare provider and private employer in New York State. I've had the privilege of knowing Michael now for many years, and we at Simone Development have had the opportunity to work together on several projects. What I have observed about Michael is his unwavering passion for the future of healthcare. We share a common belief in healthcare equity and a mission to improve health through patient-centric, integrated medical services that benefit communities. He is a true visionary and a globally recognized transformational leader in the world of healthcare. We are very, very fortunate and honored to have him join us here tonight as our keynote speaker. So without further ado, please join me in welcoming Michael Dowling to the podium. Come on, Mike.
Thank you all very, very much. I appreciate the invitation. Delighted to be here. And as Susan Fox said at the beginning, it's absolutely wonderful to be in person. We've had enough Zoom. The Zoom has functions, but being together in person, there is no substitute. Relationships matter, friendships matter, socialization matters. So let me begin by, first of all, congratulating the Westchester County Association for all that you do, everything that you have been doing. I've been quite familiar with it for a long time. I've been at many of your meetings in the past. And I also lived in Westchester for a long time. My son was born at Phelps Hospital up the road. And I actually worked here in Tarrytown. For many, many years, I was the head of the Fordham campus, when it was located at Marymount College years and years ago. So, and I lived in Peekskill. So I am very familiar with this neighborhood. I spent quite a bit of time years ago. There was a bar downtown. It was called Scorpio's. Does anybody remember Scorpio's bar? Oh, I saw you in there. I remember. Yeah. I don't know if it's there anymore, but it was good for relaxation after a very, very busy day. So first of all, I want to say congratulations to Susan Fox for her leadership, this organization, but also of White Plains Hospital. As she mentioned, Susan worked with me for many, many, many years. An extraordinary talent. Helped mightily during the days of the big mergers, especially the one that she referenced when we were merging LIJ and North Shore. And so for everything that you've done, Susan, for your contributions to us and your contributions as a competitor now at White Plains, we thank you. And I also want to reference her husband, Jeff, over here, who actually also worked at LIJ with me for many, many years back in those days, which were a little bit tumultuous. I mean, mergers are not easy. Mergers are difficult. You've got to learn how to handle them the right way so that everybody can have a win-win situation. I also want to say a special thanks to Judith and to Rita for everything that you do and for being honored tonight. Congratulations. Thank you so, so much. So, I'd like to make a few general comments up front. And one is that all of us who are involved in healthcare, and whatever aspect of healthcare we're involved in, we have to sit back ever so often and think about how proud we should be to be in the field of healthcare. What a wonderful, wonderful profession to be in. There are not too many other places where you can get up each morning and go to work and have the direct opportunity to make life better for somebody else that day. It's something that's important to remind ourselves of on a regular basis, especially in the world that we live in today, that we're so fortunate to have that opportunity to improve the condition of others who are less fortunate than we are. Many of those people today are in our facilities, in the hospitals. Most will get better because of the work that everybody does. So being proud of your work is important, even at times when your work may get inappropriately criticized. It's very, very important to have pride and to be able to defend what you do while recognizing that we always need to improve and get better all the time. The second point I want to make is to also reflect on history a little bit and to think of the extraordinary successes that healthcare has accomplished. The science, the new discoveries allow us today to do things that were almost unimaginable 20 years ago, 50 years ago. We sometimes forget. Sometimes we're so caught up in today, we don't put it in context. If it was the 1970s and you had a heart condition, there was very little we could have done for you back then. Imagine today. We can replace a heart, replace a lung, replace a pancreas, replace a kidney. We can actually do multiple replacements of those organs on the same patient on the same day, today. Imagine what we can do in orthopedics. Imagine what we can do with young babies today that we couldn't even think about doing years ago. We have come a long way. We've added almost 40 years to life in the last 60 years. Not that long ago, the average life expectancy was around 47 if you went back to the 1930s. And look at it today. All the result of the wonderful work of extraordinary pioneers, researchers, and science and discovery. And when you reflect on that brief history and you think about what's happening today research-wise, imagine what it will be like a decade from now, 2 decades from now, and what we will be able to accomplish that today we can't even imagine, but our kids and grandkids will sit up at a podium like this at some point and say, imagine what we could have not done in 2023 that we can do in 2050. Again, have pride in what we do. And the third general point is that you often hear about how difficult the circumstances are, and we live in some complex circumstances, and healthcare is a very complex business. And the world we live in today is pretty complex. There's financial pressures, there's toxic politics all around us all the time. There's the inability for people to reach consensus and have respect for one another. We have increased competition all over the place, which I think is actually good, not bad, but really good. But it's also important to remember that it doesn't matter what happens to you in life. It matters how you react to it. And that's where leadership comes in. Leadership is about having a sense of continuous optimism, continuous positivity, continuing effort to build trust, to build respect, to look forward, to imagine tomorrow, to think that tomorrow and believe that tomorrow will always be better than yesterday, and to continue to have a persuasive attitude towards the possibilities that we can achieve. Leadership matters. And I had a wonderful example of this. Personally, some of you have already referenced it because I was very, very fortunate on Monday to spend over an hour with President Zelensky from the Ukraine. Because we have been doing an awful lot of work in the Ukraine right from the beginning of the invasion. We send a lot of supplies, we send ambulances, we deal with their doctors and their nurses. And as was referenced for those of you that saw it, we do take care of many of their terribly injured soldiers, mostly amputees. So they come to us at Staten Island University Hospital, no legs, no arms, terrible injuries. We build prosthesis, build them back the best way we can. Now what's amazing, by the way, is most of them want to go back to the front. But President Zelensky came. He's a war president. Was here for the UN. Took the time to travel from the airport all the way to Staten Island in the rain, in slow traffic. If anybody's ever traveled that road, you don't do it quickly. Why? To say thanks to his soldiers, his frontline workers, the people who do the real work. He spent an hour, and I was with him, and I was very fortunate, but I was reflecting, despite the situation that he's in, the difficulty he has, he shows true leadership because he cared about what matters the most. He cared about his people. Something that we all, in our own leadership capabilities and our leadership positions, should keep in mind all the time. You can always find the time to do the right thing. So leadership matters. You build trust, you build a sense of belonging, and you have perpetual optimism. So obviously in healthcare, there is so much that we can talk about. So what I've decided to do is just mention a few points. Each one of them, by the way, could take an hour to discuss. But I just want to raise, I decided to raise 7 points. Some of them you all know, but they're all worth reflecting on a little bit. And so I'll just mention each one. And then each one could be the source of a continuing discussion by many of you as we go forward, because quite frankly, as you all know, there are no complete answers to anything. There is no complete success on anything. No matter how much you fix something, it comes back another way, another day. What you try to do always, of course, is to make continuous incremental progress and have the courage to do so. So the first point I'll mention for all of us in healthcare is to be less hospital-centric. What I mean by that is most people who reflect on big systems like us and others seem to come to the conclusion that all we are about is all hospitals. But remember that hospitals are only one cog in the continuum of healthcare delivery. It's just one piece. Healthcare doesn't begin and end with a hospital stay. Hospital is one part of the delivery system. An important part, a very important part, because that's where you need to be if you have serious difficulty. But more and more care has been and will continue to be done outside the hospital. Outpatient, ambulatory care, home care are going to continue to accelerate in scale and size. At Northwell right now, for example, only 45% of our total business is hospital-based business. The rest of it is non-hospital. What that requires us to do is to think about where we can actually take care that was once in a hospital and move it out into the community close to where people live so they don't have to travel to get it in a place that they shouldn't get it, where they shouldn't get it anyway. You should only be in the hospital for those services that absolutely need to be in the hospital. Many of the new competitors that are entering the field are working on the ambulatory outpatient side. That's where we also have to be in a very aggressive way. At Northwell, we have 900 outpatient locations, 900. We will have over 1,000 in a year because that's where most care is going to be delivered. Hospitals, in the future, the larger hospitals will be places where there'll be serious operations done, babies will be born, and intensive care will be provided. The bulk of everything else will be on the outside. So that requires a little bit of a perspective and attitude by lots of people in healthcare because they think too much hospital. It's very common in Europe where they're hospital-centric, hospital-centric. That's not the future. The second point I want to mention is that we have to be more consumer-centric. What I mean by that is patients, customers, or consumers, I use the words interchangeably, because a patient is no longer the subservient entity being treated by the doctor or the nurse, where the doctor or the nurse knows everything and the patient knows nothing. That world is gone. They have more information, more knowledge, especially with all of the access to have the information today. So service is going to be extremely important. Convenience is going to be extremely important. We should look at our organizations from the outside in, not just always from the inside out. What matters to the public is what we have got to deliver. How the public perceives what we do is going to make the distinguishing characteristic of how we do it. So being consumer-focused is important. All of you that are involved in this business, you get letters all the time from patients. Well, let me put it another way. You don't get that many letters directly from patients. You get them from patients' families. Now, what do they talk about? Access, service, convenience, quickness of service, how well staff treats them. So service and convenience is a central component of quality. We often look at quality as being purely on the clinical side, and that's important, and I could spend a whole other time talking about that. But service and convenience is a key component of quality. And we in healthcare traditionally have not done it well. Other businesses do it better than we do it. We have to learn from others to continue to enhance how we provide better service, better convenience in a more humane way, most of it outside the hospital. The third issue is one that would take an awful lot of time to discuss in any great detail, but that is how to optimize all the new technologies that are available today, such as artificial intelligence. It has unbelievable potential to make life so much better for everybody. It can enhance efficiency. It can relieve us of doing a lot of the laborious work that we do by humans today that will be done and can be done using technology. But we have to be very, very, very careful, because I get a little bit fearful that everybody looks at this these days and say, oh, we have a wonderful new thing and it'll solve everything. No, it won't. We cannot lose sight of the human element in care delivery. And we cannot lose sight of the dangers inherent in AI unless we control it. When the machine brain becomes much smarter than the human brain, and the human brain can't figure out what the machine brain is doing, we're going to be in trouble. So it's a combination of the human brain with the machine brain that we have to keep in balance. Otherwise, we can walk down a road that can be very, very, very dangerous. That's not minimizing the potential of AI, but it is warning us to be very, very careful about not letting it go too far and not be able to understand what it is doing. The potential for misinformation using AI is pretty extraordinary, and we see an awful lot of that these days, even with the technology we have today, and the potential over the next number of years is absolutely unbelievable. And of course, as you all know, AI has been around, definitely since the 1940s. Its capabilities are enhanced dramatically, but it's not a new thing. In fact, some people would say it's been around since the development of the Morse code in the 1850s. It's the capabilities of it these days that we have to be wary of, use appropriately, and be careful of. The fourth issue is something that was referenced earlier by some of the honorees that were up here, and that's the unbelievable opportunity we have to develop in a much better way the workforce of the future. If you think of the skills that we will need a decade from now, and think of the capabilities that our staff has today, we do not have the skills today that will be sufficient for the opportunities that we will have a decade from now. every staff person will have to be trained, for example, in what AI means. I remember meeting one of the heads of the big technology companies one time, and I asked him, I said, what would you do if you ran a big health system? And he said, I would hire programmers. So we have to dramatically enhance the training and education of our staff to be prepared for a new world of healthcare in the future. And I'll come back later to how we define healthcare. That's another issue I will raise in a minute. But this requires all of us to actually do a lot of our training internally. It requires us to challenge the academic institutions to do it quicker and better. We can't wait for some academic institutions to take years to change their curriculum to meet the needs that we need now. So we're going to have to be doing it ourselves and putting pressure on those academic institutions to change. And we at Northwell are quite involved in that. We work with a lot of universities, but I'm going to start doing my own. I'm going to start creating my own certificate programs, my own training programs, my own degree programs, because many academic institutions need that kind of impetus. Many of us inside our own organizations, we have the talent, we have the faculty, we have the skill. We can do so much of it ourselves. There needs to be a push here. So while healthcare is going through phenomenal change, in my view, academic institutions, colleges and others will go through major, major change in the future. You see some of this beginning to happen now. But when I look at our workforce and I identify what I will need a decade, 2 decades from now, the academic institutions are not equipped today to meet that need. That doesn't mean they can't do it. That doesn't mean they won't do it. But it's a combination of they doing it differently and we doing it differently and doing it together. I just, by the way, earlier today I left the Bloomberg organization because we have adopted a number of schools in Manhattan working with 8, 9, 10, 11, and 12 graders about how to, and I know a lot of people are doing this, but we may even build a school on this, but to actually provide the opportunity for kids at that level to get into the healthcare workforce of the future. And I get a little annoyed when I have people standing up saying we will have a workforce shortage 20 years from now. We'll only have a workforce shortage 20 years from now if today we stand still. If today we do what we need to be doing, we will not have it in the future. You create it today for the future. You don't wait until the future occurs. The fifth item I mentioned is to be aware of the growing revenue imbalance. Now, what I mean by that is, and this is a big issue that I know Amy will have to deal with and the state will have to deal with. When you look at most of our organizations these days, we have 3 revenue sources. You have commercial revenue from insurance companies and et cetera, commercial business that pays you okay, not what they paid you before. And then, but that's flattening and maybe reduce. And the payer mix that is growing is the public payers. If the public payers grow faster than and the commercials decline, you're going to be in a situation where you're going to have severe financial problems. We have, as you know, like a growing 2-tier system in New York, where we have many, many institutions that are primarily funded by government that are completely underwater financially, struggling mightily to provide care to their local communities. Because in the current environment, where you have labor costs that are very, very high, supply costs that are very, very high, and 80% of your revenue is government revenue, there is no way you can make it. This is not about bad management. This is a complete imbalance between labor costs and supply costs going up at one level and your payer increases going up at a much lesser level. And it doesn't take much of analysis to figure out where you're going to end in the future. This is a big, big issue. we at Northwell, we are the second largest Medicaid provider in the state of New York. And I'm proud that we're doing that. But I can only do that as long as my commercial base of business stays even or hopefully grows. That's true at every hospital that is trying to make it. Sometimes there is a misunderstanding that if we were all a little bit smarter, we'd all figure it out. But at the end of the day, we can always get smarter. You can always have better management. There's always a screw up here or there. But it's a fundamental imbalance in the pair. If you have an Emmy, and did wonderful work last year with the governor to give an increase in Medicaid, but it was about the first increase in Medicaid in about 10 years. But your labor costs are going up 6-7% a year. If you want to accelerate the two-tier system, you keep that imbalance happening, and you're not going to be able to straighten it out. Big challenge for government, both at the federal and the state level, and of course a responsibility in all the rest of us to do everything we possibly can to be as efficient as possible. So that's a key issue, and it gets, quite frankly, to the equity issue, big time. If you underfund, you're promoting inequity. You can't be told to go into communities to do more and more and more, but every time you do it, you lose your shirt. That's only sustainable for a certain period of time. It is not sustainable long term. So the responsibility for whatever inequities we have is with everybody, government and all of us. It is just not only one sector. It's all of us together that can either promote inequity or solve the equity problem. And the next issue, this is something that I think that we all have to think about a little bit differently, and that is, what do we mean by health? How do we define it? And there was an article in the New York Times a couple of weeks ago by Nicholas Kristof, who's a writer I respect. I happen to know him. He does very, very good stories. But the article was, the headline talked about the scandal of the healthcare system in the United States. And I took affront at that because I don't think the health system in the United States is a scandal at all. I think we do phenomenal work. But if you read the story, most of the issues that he talked about that needed to be solved were social determinants of health issues. Poverty, obesity, inactivity, bad nutrition, gun violence, drugs and alcohol. So you have the medical care delivery system, which most of us are in, and we do very good cleanup downstream. We handle it very well. But we all have to spend an awful lot more time upstream. I mean, what Judith was mentioning earlier about all the social determinants issues, we have to spend so much more time there. Because if we don't solve that, which is a societal issue, not a hospital or a nurse or doctor issue, we can be catalyst in solving it. We have to be involved in it. We have to do more than we're doing today. But I don't want to get blamed for the fact that that guns are the leading cause of death for children and kids these days. That's a health issue. That's a public health issue. So you want to throw up statistics that we do a bad job and you include killings and injuries from guns and you blame us? No. This is why, I've taken, and Northwell has taken a major role in driving an agenda on the gun violence issue as a public health issue. And I now have 55 of the CEOs of the big health systems in the country working together to do an awareness and education campaign on this issue. And you just think about it for a second. This is not what the United States should be distinctive for. This is not something we should be able to stand up and say, we, the United States, have as the reason for the most deaths of kids is guns, irrespective of your politics. It is absolutely asinine. At our children's hospital, we've had more than 400 100% increase in kids coming to our hospital in the last year and a half with gun injuries. The person who runs the gun program for me, Chetan Sathya, surgeon, trauma surgeon, his first case was taking a bullet out of a 6-month-old baby who was left paralyzed. Whose fault is that? If you go into a store and companies advertise salt-laden goods, sugar-laden goods, and market them to kids, that promotes ill health, what responsibility do those companies have for an improvement of health? Are they not in the health business? Yes, they are. So we have to broaden the definition. Lack of a job is, promotes poor health. Bad housing is health. Bad food is health. So we have to get away from thinking that it all lays with the responsibility of the official medical care delivery system, because let's be honest, we're in a medical care delivery system business. We have not been traditionally in the overall healthcare business. That's a much bigger issue, but we have to be there. The social determinants of health issue, if we don't solve them, we will never improve the health status of Americans. And one or two other comments. There are two other issues that we have to be well aware of. There are obviously many. I'll just mention two. One was mentioned again by Judith earlier. By 1934, the population over the age of 65 will be larger than the population of children in the United States. We have been so successful at extending longevity, although it has tipped down a little bit in the last couple of years. But we have been so successful because of the improvements in health and public health that we're all living longer. But the aging crisis is going to be one of the biggest challenges we'll have to face. It'll be one of the biggest challenges for healthcare providers, dealing with issues of chronic illness, dealing with all of the other social and psychological issues that are associated with aging will be one of the big issues facing us in the future. It'll also be a huge economic issue, because where at one time we had 3 kids for every 1 elderly person, in the not too distant future, we'll have 3 elderly persons for every 1 child. So the aging issue, the gray tsunami, as people call it, is one of the biggest issues that we have to face. And the other one is mental health. We have never seen, at least at Northwell, but it's true across the country, we've never seen such an acceleration in the number of people suffering from mental illness. The population born after the year 1995 has the highest incidence of depression, anxiety, and suicide of any population ever studied. We are, at Northwell, we are also the second largest provider of mental health in the state of New York. It's accelerating at such a rate that we do not have anywhere close to the capabilities or capacity to deal with it. We are expanding our services. We've opened new hospitals. We've opened new services. But we're only touching the tip of the iceberg here. A huge, huge issue, especially among the young. Much of it, by the way, associated with social media. You talk about having addictions to fentanyl, addictions to drugs. I drive the car, the person in front of me stops at a traffic light. He's slow getting off because he's on the stupid phone. You can't get away from it. Another form of addiction that is causing severe difficulty among so many people, especially the young. So the whole mental health issue, and again, it's an issue for government because most of the mental health services are Medicaid funded, so the more you do, the more money you lose. That has to be, at some point, rectified. So these are just a couple of items that we have to be thinking about and discussing over the next number of years. But I'm an optimist, and I believe that we have wonderful opportunity to do better. I don't look at the future as having challenges. I don't use that term. It's all about having opportunity. Every challenge is an opportunity. We just have to be unbelievably adaptable. We have to be very comfortable with ambiguity. We have to be looking long term. We have to be willing to take public positions on public issues that matter. I get annoyed when I hear this argument that heads of corporations and heads of large organizations should not be standing up talking about public policy issues. Yes, they should. If you want to improve the health of their communities, stand up and be counted. Don't let the politics deviate you from that responsibility. We have to be talking about gun violence. We have to be talking about drug addiction. We have to be talking about housing shortages. Every CEO, not just healthcare, because every CEO and every business, healthcare or not, have a component of a health mission. All of us are involved in the health arena. So we got to be willing to stand up. Difficult in this political environment, but we're in this political environment these days. We're in this toxic world because so many people are unwilling to stand up and talk, including so many of our political leaders who don't have the courage, especially at the national level, to take positions that they believe in, that they know they should, but are afraid to do. That is not right. So, again, I don't want to keep going on. There are lots of issues here, but we do great work. We should be proud of what we do. We make unbelievably positive change. But it's a lot more than the delivery of medical care. Most of us are in the medical care delivery system. We have to be more broadly involved in overall health issues, including all of those social determinant issues. Because if we don't deal with the upstream, we'll never be able to accommodate fully the downstream, and we will not have the effect. So we have to have a different perspective, a broader perspective. And you know, David Thoreau has a wonderful quote, which I've used a lot. He said, you know, it's not what you look at in life that matters, it's what you see. I see opportunity. I look at that opportunity with a sense of optimism. Progress is made by good people doing good work and be willing to talk publicly about it. So thank you for listening. Appreciate it.
Michael's going to take one or two questions from the audience in case anybody, just raise your hand and we'll find you with a microphone. We just have time for maybe one or two questions. I can't see anything.
Say that again?
Over here, Mannheim? Yeah.
Sheriff Department and President of Medical Board and medical staff. Do you think artificial intelligence need to be regulated by any agency? Because it can be going both ways. It can be very helpful, it can be very harmful. Who will supervise that? Who will take care of this issue? Who will go and say, that's right, that's wrong?
Well, if you're looking at it nationally, I think that eventually, and Europe is moving in this direction, there'll have to be some rules around AI. There'll have to be some regulatory oversight, for sure. And even some of the major players who created AI are now standing back, basically saying that if we don't put some rules around it, it's going to be disastrous in the long run. Inside an organization, I think those of us inside Northwell, we put a team together to oversee and review all of AI, to make some determinations about what should we be doing, what shouldn't we be doing, what are the rules. We haven't yet figured out what those are. We'll be putting a structure in place to make that happen. I just don't think you can let it go automatically without some guardrails around it. And I think it's the responsibility of each of us in our own organizations to set some rules. But eventually, I think there are going to have to be federal rules on this, as is happening in Europe right now.
Thank you. What is your plan to execute the proactive distributed healthcare vision in the future?
What, if I get the question, it's about access to care?
Access and
Yeah.
bringing the proactive care to the population where they reside.
Well, we're doing it. I'm a big believer that you take care to where people live. You move care out. That's why at Northwell, for example, we have 900 locations. You cannot go in many of our communities, you cannot go more than 6 blocks without seeing a Northwell facility. Most of that service was inside the hospital years ago. You take it out. Most cancer is outside. Imaging outside. Surgery. Pretty much all orthopedic surgery, with the exception of major spine surgery, outside, close to the population. Cardiac. We're also used to going to the hospital to have stents put in. I have 3 of them, right? They're working. And by the way, the reason that they're working, they were made in Ireland. In fact, before I put them in, I visited the factory. But the point that I make is, those services within the not-too-distant future will be done outpatient. The question is to make sure that we have an equitable distribution of where we put those locations close to the community. And that way you deal with the equity question as well. You should not be requiring people to traveling long distances to go to a healthcare hospital to have services that shouldn't be in the hospital to begin with, which be out in the community. This is why, as I mentioned earlier, some people may have missed it, but only 45% of Northwell's business is hospital business. The community and many of the advocates community think we're all about hospitals. We're not all about hospitals at all. We're about care delivery out into the community. And you have hospitals that do what hospitals should do only, and you get the services out. And so home care, another one. Home care is going to explode. The use of all of the new technologies that allows you to monitor remotely, which you've been doing for a while, home care is going to explode. Of course, it depends on the nature of the family situation, whether or not it's appropriate. And the other thing is, you could talk about a lot of it. One other issue is that we have to have a major caregiver training and education program. Caregivers, family members, should be extensions of healthcare providers. So that people don't necessarily have to go to a healthcare provider when it's not necessary. And let me say one other thing. So you gave me an opening here. You know, all of the new technologies where everybody's wearing a watch, and it's going to increase demand for healthcare. It's not decreasing demand for healthcare. It's going to increase demand. Everybody who sells you one of those gadgets will tell you it's going to save money. It's going to increase demand. Because more people are going to know an awful lot more about themselves. The more you know about yourself, the more you're going to get worried about it, the more you're going to go to the doctor. You're going to get up in the morning, look at your watch, and say, holy crap, I got to run to a doctor. So don't buy, they're all terrific things, but don't buy the argument that they're going to reduce healthcare costs. That's a joke. It's good stuff. I'm not against it, but don't push it using the wrong argument.
Yes.
Oh, one more. Okay.
Thank you. One more. Could you please address the role of the skilled nursing facility in providing post-acute care in the continuum? You referenced the hospital is providing roughly 40% of your care, and then you have outpatient services. But the skilled nursing facility has been a partner, I think, to the acute care.
Oh, absolutely.
Yes, and is suffering from these financial imbalances that you described so well. What do you see as the potential future?
We have our own nursing homes inside Northwell, and we have relationships, priority relationships with about 20 others. So obviously they're a major, major part of the continuum of care. And the financial pressures that they're suffering from, obviously over time will have to be the staffing issues as well. Is a major issue that has to get addressed, just like it is with hospitals and others that are suffering a similar way, where the payer mix is the wrong payer mix. I mean, what people, and everybody here understands this, but a lot of the public don't, you can be full with patients. You can be packed to the gills and be losing your shirt, depending on the payer mix. So there has to be more of a balance in the payer mix. That's going to put an awful lot of pressure on government in the future. And as Amy mentioned, that's going to make it more difficult because the budgetary situation in government is going to be more difficult. They're definitely a big part of the continuum. And we have to be figuring out how we deal with the revenue imbalance. We have the same situation inside our system. But it gets to, well, the other thing that we're doing, and a lot of our health systems are doing, I'm working very hard to find other ways to make money than the traditional ways of making money. So we start our own pharmacy business. We have our own supply chain business. We have our own lab business. So I'm trying to create commercial businesses to raise money to offset for the lower reimbursement and allows me to expand a lot of the services where the reimbursement is much lower. It's all a transfer of revenue.
Can you speak to the issue of the intersectionality of digital equity in terms of healthcare delivery and in terms of your workforce development?
Well, on the workforce development side, we're unbelievably diverse in our organization, and I'd say that is pretty true of a lot of organizations. That's why we're working very deliberately, and this is what I was doing all day today before I came here, with a lot of the schools, the inner city schools, the poorer schools in many of the neighborhoods, providing opportunity for kids from those schools to be able to get into employment opportunities in healthcare. As part of our medical school, we have a pipeline program. We deal with a couple of hundred kids from the poorest schools in Long Island. All kids that we involve with, a couple of hundred of them, all graduated college. 10 of those kids from those schools are now physicians. 2 of them OBs in our own business today. So now, similarly, when it gets to the technology, it's making sure it's available to everybody to the extent that we possibly can, educating people in the community about it, and the schools play a huge role. We got to start in many ways with the schools at the lowest levels, enhancing equity to access to technology at that level, and we involve with them. And I'm a big fan of apprenticeship programs. I believe good education is academic learning and learning by doing. You learn by doing. So we have hundreds and hundreds of apprenticeship programs targeted to the poverty schools. And I don't mind saying that. I grew up in poverty myself, and I understand it. We focus so much on them on the technology side as well as on the workforce side.
Thank you, Michael Dowling. So glad he had the opportunity to work a joke or two in there at the end and bring it back, even if it was at the expense of his own health. So thank you for that, Michael. But these are serious issues, and it requires some serious thought from some serious thinkers. And we're very fortunate to have many serious thinkers here in the room tonight. And we at the WCA feel fortunate that you have chosen us as the vessel for being your advocate, for being your talk shop, for being the organization that helps you advance some of these big ideas in healthcare. We're also fortunate to have Amy and Leader Cousins. They're right here in Westchester, and they are 2 of the most influential people in state government right now dealing with the issues that are important to us all here tonight. So thank you very much, Amy. Thank you also to the WCA staff. We have to mention, and please give them a round of applause for everything they do for us, not only planning the event, but the tireless work they do advancing your issues. A special thanks to our Amy. She mentioned that this is her favorite event of the year. I always thought it was our weekly staff meetings, Amy, so a little disappointed to hear that. And lastly, on behalf of Susan and the rest of our board and the staff, thank you all for coming and supporting our work. Have a good evening.